More than 170,000 people are diagnosed with meningioma every year. That is when a tumor forms in the layers of tissue that cover the brain.
Usually the tumors are benign and not cancerous, but sometimes they cause major issues. As for Claire Leyhane, a tumor started growing behind her eye, pinching her optic nerve and affecting her sight. But after getting surgery at Northwestern Medicine, she has now fully recovered.
And joining us now, Claire and her doctor, Dr. Stephen Magill. Thank you both for being with us.
Thanks for having us.
Of course. Anxious to hear more about your story. So, Claire, I'd like to ask you, when did you begin to notice that something was wrong, and what was your next step?
You know, it was in August of 2021 that I started noticing my eyesight in my right eye was just a little bit off. And I thought at first I just needed glasses or something. And that time we were trying for a baby. So I kind of put that ahead of my eye. But when it came to be about January of 2023, I started noticing even more progression with my vision loss, and I definitely needed to be seen. So at first I wasn't sure where to go. I was told a couple different doctors and then referred to a neuro-ophthalmologist. So I then kind of talked to them and found out it was damage to my optic nerve, but they weren't quite sure what it was.
Wow.
Dr. Magill, tell us what this means to you to be able to ultimately diagnose this and then surgically fix it.
Yeah, you know, her tumor, oftentimes meningiomas are large tumors and you find them out that way, but hers was right where the optic nerve comes out of our eye socket and goes up to the brain. There's a small canal through our skull, and her tumor was right there. So it was strangulating her optic nerve, and it was difficult to see on an MRI. To be able to identify that, diagnose that, and then help her realize that what we can do to decompress her optic nerve, do a surgery where we go underneath the brain, behind the eye socket, behind the eye, and just remove that bone and the tumor, compressing it is an amazing thing to be a part of. And, you know, in any time we do surgery, there's risks, but to see her come through this, her vision getting better, having removed that from the optic nerve around the artery that supplies the blood to the brain, it's a special thing. It gives a lot of meaning to the work that we do.
Absolutely, no question. Claire, now that surgery's over, what are you most looking forward to?
You know, surgery's only been just under 5 weeks and recovering still, but I'm just looking forward to kind of getting back to life. And when I first met with Dr. Magill, our first appointment together, he told me something that really stuck with me. And dealing with this for almost 3.5 years, that I've had a lot of anxiety about it. You know, why is my vision going? Am I going to lose it?
Sure.
And that eye, and all, you know, both my eyes. So I'm kind of just ready to get past it. And he said that I'm hoping that this is just a bump in the road in your life. And that really stuck with me because I've had a lot of anxious feelings about this, and I want to be there with my 2 small boys and be able just to spend time with them, go back to how I was living years ago, you know, playing volleyball, basketball, just kind of like living my life. And I'm kind of ready to go back to that and be present in the life, because sometimes this would kind of hinder that when I'd be, you know, afraid I was losing my vision even more. And as it was progressing, not knowing what the problem was too, because it was a quick turnaround for us finding out that it was this meningioma and then getting right into surgery 3 weeks later.
Well, our vision is so critical. I don't need to tell either of you, and the idea of losing it must have been horrifying, especially over the course of 3 years, when it seemed like it just kept getting worse and worse, and you didn't really have an answer. And now you do, not only an answer, but a fix. It must just be amazing thinking that you're going to be able to watch your kids open their Christmas presents tomorrow.
Yeah, how special.
So true. Yeah, I won't have that like weighing on me that, oh, am I going to be able to keep, you know, seeing this going forward? That I can just enjoy it. I can be in the moment. I can be there with my boys and my husband and really just be happy. I think that, you know, that's my goal.
Dr. Magill, any last takeaways you'd like to pass on to our viewers? I'm assuming you would encourage people, if there's a problem, to reach out to a doctor anytime, because help could be on the other side of that phone call.
Yeah, I think it's important to get a second opinion. You know, Claire's diagnosis was really difficult because the tumor was so small, but in such a critical location. And so I think any time where you don't know what's going on, reaching out, getting a second opinion, trying to understand, hey, what's going on and what should I do about this? I think really everyone should feel comfortable doing that, making sure you're getting the right care that you need.
Well, congratulations to both of you. Great work, Doctor. And Claire, we're so happy to hear that things are going better for you. We really appreciate you sharing your story with us today, both of you, and happy holidays to you both.
Thank you.
Thank you.
Thank you. Happy holidays.